Love and blessings, beautiful people. My name is Elizabeth Vanderwalt. I'm a holistic doula and a women's health coach. I'm currently residing in the prairies of Canada, that is Saskatchewan actually. Today's video is going to be a heavy topic, and I want to include a trigger warning because we're going to be talking about miscarriage and pregnancy loss. So if this is something that, is just too heavy of a topic for you, I did include it in the tags and I included it in the title, but I wanted to make sure that the first few seconds of this video you actually saw and you got to hear what this video would be entailing. So please, I'm okay if you skip this because you need to take care of your mental health first. Miscarriage is a taboo topic, and this is beginning to change. It's why videos like this are needed, and it's part of my message for women out there. It's part of my message for everyone out there. My goal is to provide you with the knowledge to take back control. For too long, we haven't had control over our own bodies. Sadly, 1 in 4 pregnancies end in miscarriage. Many people, but not all, choose to announce their pregnancy at 12 weeks. In this 12-week period, a pregnant person, a pregnant woman, is particularly vulnerable. There is a lack of support, and this is coupled with suffering alone through a loss. When you are over 30, there's a lot of possibilities running through your head, especially if you're still trying for your very first baby. You're often struck with a thought: my body wasn't made to have a baby. I'm too old for a child. Something is wrong with me. None of that is true, because often we take the blame and put it on ourselves. Even more so when we have recurring losses, which can be from so many things that we don't even fully understand at all times. So we ask the question, can we prevent loss? In the year 2000, a study was done, and I'll post the link in the description. I'm going to get real science-like and repeat some of the text that they wrote. Recurrent miscarriage syndrome, also known as RMS, is a common obstetrical problem affecting more than 500,000 women per year. 7% are secondary to chromosomal abnormalities. About 10% are due to anatomical abnormalities, and about 15% appear to be caused by hormonal abnormalities. So this comes down to progesterone, estrogens, diabetes, or thyroid disease. And only 6% cannot be explained. And the remainder, about 55 to 62%, are caused by blood coagulation, protein, or platelet defects. So as you can tell, that's a lot of talking. Recurring miscarriages might be due to a handful of items. But in this study, and I'm hoping I can find more up-to-date ones, seeing that this was 25 years ago, it can be caused by hormonal problems. But a bigger problem was actually the blood coagulation, protein, or platelet defects, which, if you have a specialist on your team or in your area that may be able to, with certain therapies or even medications, support that, which can better support your body for future lack of a miscarriage. Asking your doctor during a miscarriage for a complete blood count, telling them as a possibility to test for you, could better support you. Oftentimes, we don't know that these options are available to us. So we're just guessing in the wind as our medical care team provider, and we need the options to know. So that is your number one tip, is that the next time a miscarriage might be happening, get them to test for a complete blood count. Before we continue, I just wanted to let you know that you are amazing. If you had to look this up and are going through a tough time, I wanted to tell you that you're doing a powerful thing. I am also wanting to give my condolences to the babies you have lost. Taking your health into your own hands is so important and necessary. But you don't have to go this alone. I offer support not only for the fertility journey of conception, but especially for the loss. Having someone to share your story and speak with is important through the grieving process. I also offer this service by donation. If you're looking for my support, please feel free to contact me at the email below. Having a doula on your team can make such a difference in your journey, and the number one thing is the level of support to care for you. A while ago, I posted a short with some information on improving egg quality. There is a book I highly recommend, and I shall place the image on the screen here. It starts with an egg. If you are trying to conceive and are going through a countless list of ideas to try, I ask you to start by reading this book. The first 4 topics are ones that I consistently bring up in my cohorts and my one-on-one coaching doula relationships. This topic involves toxins and the environment that we live in. There are things that can affect our body without us even realizing. Vitamin D deficiency, hypothyroidism, celiac disease. I want to expand on celiac disease because it gets into so much information in this book. But with celiac, it could possibly show us other symptoms first, so most doctors don't test for it, and it can affect your fertility, as it messes with your absorption of folic acid and other vitamins. Crazy, eh? Who would have known? And this is not something often shared with you when you're first diagnosed with celiac disease. Our bodies can also have so many other issues, and having a well-oiled machine, which is our body, we're then needing to be the well-oiled machine, can be tricky. So I want to quote the author here, Rebecca. If you have had difficulty getting pregnant or have lost 1 or more pregnancies to miscarriage, ask your doctor to test you for vitamin D deficiency, a thyroid disease, and celiac disease. You should also get a dental checkup for gum disease. Any one of these easily treatable conditions could be standing in the way of your ability to have a baby. And so much of that we don't know. We don't know those things. Now, honestly, I don't know if we can prevent miscarriage. Sadly, our bodies know when we can hold the baby and when we can't. And it's a sad realization to say. But with today's knowledge and the knowledge of the past that we have more options than ever to support ourselves and find a way to have the baby we always dreamed of. With anything, and I say this in every video, it does take time, and often it could take up to 3 months for some to see the results of change. So don't give up right away. You're doing a good job. You're making a difference for your body, even in the result of just a healthier and happier you. Remember, you are strong and you can do great things, especially when you take your health into your own hands. Thank you so much for watching another video of mine. I really enjoy making these and trying to educate where I possibly can. Make sure to subscribe to find more tips like these and to find my cat in the background. And if you would like certain videos, please comment below so I know what you're needing for help. Peace.